Right, welcome everyone again. I'll just do a quick introduction of myself for those of you who don't know me, but I think by now, as I said before, you saw so many emails from this Alfonso Pezzella, so you probably had enough of me. But I'm Alfonso, I'm a lecturer at Middlesex University. As you can hear from my accent, I'm not British. I'm from Italy myself originally, and I moved to the UK about 14 years ago, which feels like a lifetime now. So welcome everyone, and this is our second and last webinar. We might do some social event at the end of the MOOC just to get to know each other a little bit more if you're free. I'll talk more about that later on. But for now, this is the last official live webinar of the MOOC. And today we will talk about LGBT older adults. There will be a presentation by Anders from Denmark. And then we will hear from Rikard from Denmark about his experience as well. Also, I just want to go through the MOOC again. I just want to remind everyone that the MOOC, you can do it in your own time. I know we are all chasing you at the moment, everybody on the team, on the IENE-9 team, and thanks to all of the team for the very hard work that they're doing at the moment. But if you see emails from us, these are just to trying to prompt you to do the work as much as you can. But please do not feel pressured that we're chasing you. You can do the MOOC in your own time when you can, in the evening, in the mornings, at night if you wish. It's up to you when you want to do this MOOC. And particularly, we're going to allow some extra time. This is our 4th week. Next week, it's the final week where you should do your assessment. But of course, we will allow some extra time for you to finish the MOOC. And I will say a little bit more of that. We're probably going to leave it open until the end of December for everybody to finish the MOOC in their own time and to do the assessments. So again, if there are any issues that you are encountering, not about Aptum, please. I had enough of Aptum myself, so don't mention Aptum to me. As you can see, Aptum is not the greatest platform, but it's one of the best that we have. But anything else in terms of the program, the content, please do get in touch with myself, or if you do not speak English very well, you can speak to my colleagues from Spain, Italy, Denmark, and so on and so on. I just want to say a big thank you again to Professor Rena Papadopoulos. I believe she's joining us. I don't know if she has joined us yet. Oh, she is here. Rena is the founder of the IENE project, of the IENE program started in 2008. And here we are now in 2021 doing more projects. And we're actually currently on IENE 10 as well. And IENE 11 is about to start. Of course, another big thank you goes to all of the IENE-9 team. And I'm not going to mention everybody again, just in case I miss some names, but I do want to mention the leaders in each country. So we have Roberto from Italy, we have Patricia from Spain, we have Dorothy from Denmark, Victor from Romania, we've got Christiana from Cyprus, and we have Christian from Germany. I hope I didn't miss anybody out. Please do tell me. And you can probably see them on camera as well. They were waving at you whilst I was calling them. There's obviously more people in the team, and you can find all our names on the IENE-9 website as well. So please do visit the website. Now, without further ado, again, a big thank you to Anders, who will be presenting something around LGBT older people. And thank you, Dorothy, as well, for organizing this webinar. And I think we can start. Please do tell us where you're from in the chat. And if you have any questions, do pop them in and I will read them out at the end as well. Thank you. Anders.
Thank you very much. Sorry, I'm just going to put up my presentation here. So just give me a second. So there we go. Good. Well, first of all, welcome everyone. Today I will be talking about LGBT plus elder people in healthcare in relation to the MOOC and in relation to some of the previous assignments that you've been working through. First of all, my name is Anders Valentin Johansen. I have a master's degree in public health science. Currently, I'm working on developing a PhD on the subject of LGBT elders and healthcare. We are still in the beginning stages, and I'm currently still gathering funds, but also have done a bit of a background research within the area of research on the subject of older LGBT plus persons. And I'm also one of the Danish facilitators on the MOOC. So first of all, when it comes to older LGBT plus persons as patients in healthcare, research shows there are, a couple of barriers to overcome. In this presentation, I will go through some of these barriers as well as some of the mechanisms behind. To begin with, a little background or history, if you will, to highlight some of the circumstances of older LGBT plus people, which can be attributed to shaping their realities. So, majority of older LGBT plus people have grown up, experienced discrimination, and not been accepted by society. These experiences help shape the lives of older LGBT plus people. The type of discrimination that older LGBT plus have faced early on is usually not having been accepted by society based on the sexuality, including being refused treatment within healthcare services. Simultaneously, most have faced verbal and, in some cases, physical discrimination or abuse in their everyday lives, such as the workplace. It hasn't been until recently that a lot of countries have changed their laws and views regarding LGBT plus rights. To take an example, here in Denmark, it wasn't until the 80s that homosexuality was removed as a mental illness. Also, a lot of older LGBT plus people have faced being ostracized by family members based on their sexuality. This leads to a majority of older LGBT plus people establishing their own chosen families, consisting of friends within and outside of the LGBT plus community. Due to the limitations regarding LGBT plus rights, most LGBT plus persons, haven't established conventional families with children or a partner, which I know is not the case with Richard, but I'm talking generally speaking. This is partly due to the fact that there is an underlying tone of promiscuity or within the community, and also a culture of having multiple partners. This is mainly seen within the gay community. A few older LGBT plus people have attempted to establish and live in a more conventional family setting with a spouse and children, only to come out later in life, usually following the death of the aforementioned spouse. This also results in them being alone later in life, as it can produce some resentment from their established families, but also they might face difficulty establishing new relationships romantically as well as social, generally within the LGBT plus community. Having experienced decades of discrimination, among others by healthcare professionals, can result in older LGBT plus people being fearful of contacting healthcare services, and at times prolonging states of diseases. Oops. When it comes to healthcare and mental health issues that older LGBT plus people present with, they present with a different healthcare picture than their heterosexual counterparts at the same age. Some of the primary areas that they differ include mental health, alcohol and drug addiction, physical health, and sexually transmitted diseases. This is also combined with their fear of discrimination and acceptance by healthcare personnel, and there is also a worrying barrier regarding heteronormative speech. According to research, the main reasons for a decline in mental health and depression among older LGBT plus people is due to an exposure to minority stress and internalized discrimination among this population, as well as there being a higher percentage of older LGBT plus people feeling lonely later in life. Minority stress has been proven to be associated with a diminished physical health, as well as being a cause of dementia. As most older LGBT plus people find themselves alone later in life, there is seen a high percentage who are diagnosed with depression. Especially transsexuals and bisexuals are more inclined to being depressed, as they often have a hard time being accepted within the general society and within the LGBT plus community. As mentioned earlier, older LGBT plus individuals have created their own chosen families and are often more reliant on these later in life. However, these networks tend to diminish over time, and as there might not be a strong biological network left, older LGBT plus people can find themselves alone later in life. Meeting and establishing new social networks can be difficult for older LGBT plus people, as there are usually few available older social activities targeted at the LGBT plus community, and a tendency for ageism within the LGBT plus community. These chosen families are also an important source of support for older LGBT plus patients and are often relied upon when it comes to the support with regard to health issues. Therefore, this chosen family can be seen as part of the treatment, so to speak, for older LGBT plus people and should not be overlooked by healthcare professionals. Overweight among older LGBT plus persons is usually attributed to poor lifestyle choices and is more predominant among older lesbians than older gay people. With regards to drug and alcohol abuse, as well as overrepresentation of sexually transmitted diseases, this is in research partly associated with a more promiscuous culture within the LGBT plus community. Generally, this is more pronounced within the gay community, where there is a higher tendency for having multiple partners, as well as being in open relationships. One of the main barriers that older LGBT plus people, as well as LGBT plus people in general, face within the healthcare sector is heteronormative speak by caregivers, as well as there not being an adequate focus on proper education with regards to LGBT plus people as patients. Heteronormative speech occurs for the most part unintentionally by healthcare professionals, but for LGBT plus patients, and especially older LGBT plus patients, having grown up with discriminations, these microaggressions can add to the feeling of minority stress and discrimination within healthcare, but also can be a contributing factor to deterring an LGBT plus patient from going to any follow-up consultations or using that particular health professional later on. So what can we do? Besides further research on the area, there's also a need for focus on education of healthcare professionals in regard to heteronormative speech, as well as the needs of LGBT plus patients, and especially how older LGBT plus patients differ from their heterosexual counterparts. Also, it is important to realize how the history and social network play a part into regards to their approach within healthcare. It is, as has been discussed within this course, important to be aware of one's own prejudices and use of heteronormative speech, and as much as possible try to create an inviting and open LGBT-friendly environment. So that was my presentation. Short, but yeah. I hope you found it interesting, and I look forward to any questions you might have.
Thank you very much, Anders. I'm sure if we could hear people clapping, they would be clapping now behind their screens. we can pretend that they are. Some of them are putting reactions, which is excellent. Thank you. We can take some questions if you wish. We have a few minutes, or if there are no questions in the chat, I can't see any questions at the moment, apart from, will the slides be recorded and the slides available? Yes, they will be. I will share the recording as I did with the other webinar. So before we move to questions, maybe to give people a chance to think about any questions that they may want to ask, I think we can move on to the presentation from Ricard, who will share his experience. Ricard?
I just have to remember to put on the right. You can hear me now?
Yes, we can hear you very well. Thank you.
My name is Richard, and I'm here to tell about my life as a gay man and my late husband's life. But I'm also a member of LGBT Denmark's senior group, where we work for elder LGBT people. So I recognize lots of Anders's points. As myself and my friend, my late husband, I'm afraid we are not. A lot of these things doesn't go with us, but that's how it is. I mean, people are different. Anyway, I am 78 and I'm a gay man, and I can show you. My husband died late September last year, and I can show you his picture. Well, lots of things to press on here. I don't know if you can see him. Can you see his picture? Can you see his picture?
It's a little bit too bright. I'm not sure if people.
Yeah, I'm sorry. I can't do anything about that.
No.
Anyway, is that no? Anyway, you probably can't see it, but he's black. He was black and from the Caribbean, and he died last year at the age of 89. First, about myself, I'm 78, I must remember, and I must admit I never had any problems with my family as such. I don't have any family left in Denmark. I have a degree from the School of Economics, and I've been working in the same company for 45 years until my retirement. I was a manager, a middle manager, and I was also a member of the board, sort of elected by the employees. And this was a rather large company with several thousand people in various companies making cement factories and something for the mining industry and a lot of other things. But I never had any problems, not as I can remember. And I think that goes neither in my private life. We live in a rather upper class environment in Copenhagen, and have it okay with our neighbors. As to my husband, he was from the Caribbean, from Guyana. That's in South America. You don't know where it is. It's Guyana, Suriname, a former Dutch, and Cayenne, a former French. But the culture is Caribbean. That's not South American. When Guyana became independent in '55, lots of people moved to most to England and some to America. The same with my husband's family. There's some in America, and there's a lot of them in England, most of them in London. His sister and his brother, who's now dead, and two cousins, one of each is also dead now. They're black, and Guyana is not the best country for gay people, especially at the moment. It was probably not the same thing at the time, but his family protected him. Some of them did a lot of boxing. I think that probably helped. Anyway, I have good connections with his family. took a little while in the beginning because I'm, a white man, and we met in 70, as a matter of fact, and had been living together ever since. It's took a little while, but I think the major step was 89 when we got the partnership in Denmark. So now I was married to a man, while his sister, she had children, 7 children with 3 different men. The cousin also had 7 or 8 children with 3 different men. But we lived together for 50 years. That gave some kind of respect. And they've been very kind to me after he died. I'm still connecting with them. We can't see each other, of course, but the phone, and I phone them, and Christmas card and the whole bit. So, yes, that was it. My husband was educated in England as a nursing capacity. And when he came to Denmark in the late 60s, he took a degree in Denmark as a sick help, or whatever it's called. So working in nursing homes and hospitals. Before that, he traveled a lot. He worked in hospitals in England, in Mount Sinai in New York, and Karolinska Institute in Stockholm. But in Denmark, he worked mostly in play homes. And there was one opposite to where we lived. And he had inhabitants and some of his colleagues over for coffee or tea or drinks in the garden in the summer. So there was, no trouble in that sense, and neither with me. So I was elected, as I told you, from the staff members to be on the board. So I'm sure lots of people knew about it, but I was not open. You were not sort of open at that time. And neither myself or my husband are sort of flamboyant queens, if you understand what I mean. So we can easily get away with it. But it was not a question of getting away with it. It was simply not done. Yes, more or less what I can tell of myself and my husband. I was a very tall fellow, and I had no problem as a child. I was the tallest boy in the class. That kind of thing helps. But that time I was not aware of being gay. That happened much, much later. And both my husband and myself had flings with girls when we were young and that kind of thing. And then eventually lived together for more than 50 years. I don't know if I may add a little bit about the work I'm doing for LGBT Denmark, because in that sense, I understand and I know what Anders was saying. There are gay people or LGBT people that have a lot of trouble when they get older. We do a few things. We have about 4 or 5 people working for elderly people, and elderly people is not the favorite subject in the gay circle, if I may say so. But we go on and we do some political work, and we have collected money from the state to have a project for LGBT elderlies that has ended in a website on the health authorities. It was finished a few months ago, and it's very good. It's that kind of thing with that nurses and health people, they can go in and look and what is what is an LGBT person and what are the problems and so on. I don't know how well spread it has been, but it's not too bad. And ourselves, I'll show you some of the things we are doing. We have doing sort of brochures of various types. This brochure here was printed in more than 10,000 copies, and we sent it out to nursing homes, to health authorities, to political authorities in the whole of Denmark. And I don't know what it means, but they all got about 10, 15, and we sent it out in, I think, 9,000 copies. So it was a little bit of job and cost a lot in stamps, I must say. And we got a few response, but anyway, I think we started something. There was very little point to that kind to LGBT elderly 5 or 6 years ago. We also had a nursing home in Copenhagen that 4 for LGBT people. It's opened up, I think, 4 or 5 years ago, and they do some training and they have activities once a week or something. It's not, I must admit, it's very good to have one. And they have tried to have similar ones in other parts of Denmark, but there's only 5 or 6 LGBT people living there. So it's not exactly as people are queuing up to get in. That could have a lot of reasons. Also, people perhaps don't know enough about it. These people that have to send old people to Plejehjem may not know enough about it. We are working at it. But some people like to live with other gay people, and others perhaps would like to live in an ordinary Plejehjem. As I told you, some of the things Anders says I can quite recognize, and especially if you have lived very secretly and then you need people to come into your home. That story I've heard very often. People come into your home and it might be a very gay person that have naked boys hanging all over, or whatever, a trans person that suddenly had dresses in her room and that kind of thing. Then you are suddenly outset at a time when you don't know about it. That I've heard a lot of times. Problems in Plejehjems or something, sometimes and sometimes not. I don't really know. I have heard stories, of course. There was a nurse coming here. She told me that her uncle had gone to a Plejehjem and he used to cross-dress when he was home. And it happened a few years ago. The attendants, they said that he absolutely could not have these dresses in that Plejehjem, and they simply had to tell them that the Plejehjem, it was his home and he could get dressed whatever he wanted to do. It's a brave thing to do. Not everybody can be so brave. I think that's about it. Do we have any questions?
Thank you, Richard. Thank you for sharing with us. I think it was nice to hear your story, which is a positive story, and it's great. I'm sorry for your loss, of course, but it's nice to hear. I do have some questions as well myself, but I'm just trying to open up to everybody who is on the webinar. I see Rena has a hand up. Rena?
Well, thank you so much. It was really a lovely story to hear. And can you hear me?
Yes, it's okay.
And
I can't see you. But
oh, you can. Oh, never mind. You're not missing anything.
No, I have to.
It's fine. So I was just saying that.
Yes, now I can see you.
It's very nice to hear a positive story, and you told it so well, and you know, it gives hope, I think, and kind of like what we could have if everybody was educated and everybody was accepting and kind to each other. But I'm just wondering, because you said that you didn't have any problems, I'm wondering whether, I'm sure you have reflected on your journey and how different it is from a lot of people, because generally speaking, the stories that we hear and we share and we is all about the problems and the challenges and the discrimination and all of that kind of thing. So I'm sure you're aware, you are aware, you said you know of all of these things, but you know, you must have reflected and you must have thought, oh, was it luck that I was I didn't have those experiences? What was it, you think, that kind of that was different with you and your husband, that you actually were met with you know, people were understanding and kind and inclusive to you and your husband? I'm curious to know.
Yeah. I understand
your character, your personality, your what is it?
Yes, I think one thing is that we were not obviously gay men with loose hands, and you understand what I mean. That's a very
I think
demonstrative, yeah. So
okay.
and both of us were rather tall. We were both very well educated and comparatively wealthy, and had nice positions. Especially me, I had a very nice position. So that gives some respect or something like in that sense. And
Gives power, I think, anyway,
yes,
because you could, you know,
yes,
you have all the things that you have, and
yes,
you have the knowledge, you have the money, you have,
yeah.
you know, and therefore you can punch
Mm.
back.
Yeah. Well, I'm not that type of person that punch back, but
Well,
people look at. I
figuratively.
understand what I mean. Yes, people look at me, and I had a managerial position, and that's it. I people, of course, knew. There's no doubt about that, because we lived not very far from where I work, and we had colleagues living around there. As for my husband, he was very. You must understand that in 60s and 70s, people of color didn't exist in Denmark.
Oh yeah, I know.
We were all blonde and blue-eyed.
Yeah.
And so if there was a black person, they were either dancers or jazz musicians or soldiers, American soldiers from Germany. It was very exotic, and there was not the same kind of attitude to foreigners that we see today in lots of Europe, immigrants and that kind of thing. That didn't exist. There was some kind of curiosity. I remember a thing that we were at a bus, and a little girl came over to my husband Orville and touched his hand to see if the collar came off. And,
so
well,
what was his reaction?
no, there was that kind of thing reaction you don't have from English educated persons. If it had happened to an American, that would be quite something. But he only laughed, and it was a young girl. The mother blushed, of course, but I mean, so what? That was in the 70s.
But you had so many, although you had a lot in your favor, you have described the reasons why you think, but you also had a lot against you, because as you say, this was the 60s, the 70s, and you know, there was a lot of discrimination. Just being black was a hard job. To be
Not
black
in the 70s.
today was a, you know, a double whammy kind of thing. But
it was not a problem in the 70s to be black. It was exotic. It only came.
It was exotic, but that exoticism, I would argue, had a lot of discrimination and a lot of it was really a fun, not a people were wanted to know, but at the same time, if you said to them, would you let your daughter marry this person who is exotic, they would say no. So there was a lot of deep inside, people who were not really accepting, and
I think it was more curiosity in the 70s and 80s. There was a lot. My husband worked for some time in Mount Sinai Hospital in New York, and there was a lot of discrimination. I mean, at work, it was okay, black and white working together, but when it came down on the street to take the underground or something, white people didn't say hello to black people. And that was in America.
Socialize, I'm sure. I mean, it still happens today, but yeah, I mean, it must have been something
But if I may add, my husband was also quite tall, and he was very good looking and very charming. That helps.
Yeah, that helps. It's a very
he looked very young. He was 13 years older than me, and he looked 13 years younger, much to my annoyance.
What's an advantage? As a short person myself, I understand the you know how important, you know, you there is a lot of size discrimination, and people do favor the pretty and the thin and the tall people and the blonde people. So I think, I mean, I'm just trying to think about the reasons why you not only, obviously at work you were not open gay, I don't know if people would have reacted in a different way if you were open gay, but it was like hidden. And they just kind of like put the blinkers on and they focused on how good you were at work, but you know, they weren't interested in anything else. But kind of like I think there must be something in the way that you actually dealt with maybe subtle discrimination. You may have come across it, but you knew how to handle it, and because you reacted in a kind of a positive way, maybe people were also positive. I don't know, but it's worth kind of thinking about it. I mean, I'm always kind of thinking about what is it that there is a difference between this story and this story, and especially when you have similar kind of people telling their stories, and it is so one is positive, one is negative. Why?
Yeah, but you know, when at work there were, it was an engineering company, so you know, engineers are men were at the time, and very few people there, and there were a few clerks or people working in the offices that were obviously gay, but I don't think that people might have laughed behind their backs. I don't know about it, but they were not treated badly. They were not treated badly.
Well, it's nice to hear it.
But as myself, I traveled a lot in India and Africa and that kind of thing, and we had a lot of people coming from India, from Africa, and other parts of the world. But there was no problem there, not for me anyway. But you have to be extra careful, of course. And that's wrong to say that. No, it's not wrong to say that. You have to be. In
those days, you had to.
Yeah, you had to be. Not wrong to you had to be careful if you travel in the country in Nigeria. Yes.
Of course, you still have to be careful.
Yes.
Yeah. Oh well, I don't want to just take over the conversation, but I could have a conversation with you until tomorrow.
Understand? No, if I may add something, that the thing is that in those days, gay people didn't have children, and that is the kind of thing that I don't know if you have been a good father, but that now is a miss, because I have no family left in Denmark.
Yeah.
The friends that I've left are getting less and less, a handful left or something like that. And I can't really use my family in London and New York when I have to go to the doctor and so on and so forth. So that's
a crime. Society is why, you know, why isn't that is, you know, not allowing you to have this, because as humans, we all, you know, want to father or mother children. Well, not everybody, but if you do, why shouldn't you have that opportunity?
But there was not an issue at the time, really. That has come out, and I'm very happy about it, and quite sure they have very good gay families and LGBT families. I don't think it's a problem.
Okay.
But at the time, it didn't exist.
Thank you very much.
Okay.
Thank you, Rena. I do have a question, because you did bring up families as well, and I had a question around gay people marrying, for example. When did that come into effect in Denmark, and did you get married like soon after it came into law that gay people could marry, or were you thinking even before that you always wanted to get married to your husband?
Denmark was the first country to introduce the partnership. It's called the partnership. It wasn't. It was a political thing, and it was in '89. And marriage, people thought that was a little bit too much to call it a marriage, so it called a partnership. And it happened on the 1st of October, 1989, and we went to have the partnership just a few days after. So, and we knew something, a mayor at the town hall, and he came. We had a great party at our home, not that many people, and she came home, and we had a home marriage, if you may call it that too. But that was in '89, and I think that's lesbians didn't want to marry. It's a political thing, but now it's more lesbians than gay that marry. It was a very big thing in '89, and I think that made a difference, especially, as I told you, towards my my family, my my Guyanese family in London and so on, and fathers too. The church marriage came much later in this country. I think it was in 2000. I can't remember, 12 or something like that. That means it means a lot to some people to be married in the church or something. It didn't. My husband was a Catholic, and well, there have been discussions in the parliament. And I remember at one time, especially with that gay marriage thing, there was one party there that used some very disturbing words about gay people. And I'd always been a member of the church, but I went to the church and said I didn't want to be a member anymore. That was in parliament. So it can be a strong subject. But it was in '89, and we had the partnership. It's much simpler, you know, wills and all that kind of stuff.
Thank you, Richard. I'm just going to open it up to everybody, really, to share experiences across different countries, if anybody is feeling brave enough. But for example, if I reflect back, obviously, I lived in the UK, and I know that the civil partnership came into effect in 2004, and then finally was converted into marriage, so that gay people can also occur in marriage in 2013, I believe. So obviously that did affect a few people over the past years. But also I think it was Anders who mentioned when homosexuality was still illegal. And in the UK, it was illegal until 1967. Some of those people are still alive today, and they've been going through a lot of changes as well as in the UK. Margaret Thatcher brought Section 28, which was that we couldn't teach anything about LGBT. We couldn't even talk about LGBT in schools or anywhere. As they call it, it was a propaganda. And that was only removed until the early 2000s, I believe, or maybe 2004 even. So obviously, we all need to be aware of this in terms of when we care for people and the life experiences that they all had. And we need to be very much aware of what happened in the past and how we affected people, even in terms of conversion therapy, for example. So can I open it up to other people now, if anybody wants to share their experiences in other countries, I don't know, or your personal experience? Anybody would like to come on? Roberto, thank you.
First of all, thank you very much for your very interesting and important story, and for sharing with us. Thank you very much, Richard. I would like to introduce another concept that's, according to me, is very relevant, very close to your story. In 1 year ago, we made a study regarding LGBT plus older adults, and we interviewed a sample of LGBT older adults. And in these interviews, we found a very relevant concept, that is generativity. And examining the story of life, of their life, we found that many older adults expressed their generativity in 3 main areas. And the areas where I read was personal generativity, that in literature we usually to call it queer generativity, and we found 3 main elements. That was the personal generativity, personal queer generativity, that is, for instance, receiving generativity from previous LGBT+ people, or redefining religious values according to LGBT identity, or adjusting parenting. We also found a relational generativity, for instance, caring for other LGBT+ people, or offering resource, offering helpful career, or offering other to other LGBT plus people, but also we found political and social queer generativity. That it means that fighting for rights, for instance, or to create a good context for other LGBT plus people, or transmitting knowledge to other LGBT plus people. And so this was for us was a very important study, because we understood that, of course, there are, in particular in Italy, I come from Italy, there are lots of problems for LGBT plus older adults, but at the same time, the possibility to belong to a minority group gave them also an opportunity for generativity. And also I think that this is another piece of story that we have to tell to others. Not only the fact that there are lots of problems in Italy regarding LGBT plus older adults, but also there are a space for generativity or for queer generativity. There are we have to speak also regarding resilience, personal and social resilience, and this is another way of I think to study or to look to LGBT plus older adults. Just a comment that according to me is very close to your story. For instance, maybe there are your story validated in a way also what we found in the Italian sample of LGBT plus older adults. Thank you, Richard.
Thank you, Roberto. I think that is a very important point as well to add. Just again, I know you're all very shy. Anybody else would like to share their experiences or ask any questions on the topic? Patricia?
Okay, I think you can hear me now. Well, first of all, thank you, Anders and Richard. It was really amazing. Okay, so just a small comment from my country, from Spain, regarding the marriage. The homosexual marriage became legal in 2005. But, you know, in conversation with one representative from association, this Almeria with Pride, his president, actually, he told me about this great concern regarding the rise of the extreme right parties in Spain, because now there is this debate growing more and more on those so to speak, rights that were already gained and really accepted in our society. And there is this rise of the hate speech against LGBT plus community. And there is this concern regarding the lack of security. More and more attacks are getting common. And it's a sort of contradiction, because while LGBT plus people are you know, put under doubt when they tell about this attack, etc., we can see the Nazis parades in Chueca, which is supposed to be the most LGBT plus friendly place in Madrid, par excellence, you know. So this is a great concern. And just a very recent thing that happened in Madrid is that in order to get these budgets for the region, the right party need the extreme right party support. And they gain this with the condition, or under the condition, that the economic support for LGBT plus association was withdrawn. So it's, I think it's a very worrying situation.
It is indeed, I agree. I think it's not just Spain at the moment. I think it's probably all over the world, definitely in Europe. We saw a few months ago, even in Italy, they were trying to pass a law to protect LGBT people, women, and the people with disabilities, and the law did not pass, unfortunately, and our members of the parliament were actually applauding, and they were happy that the law didn't pass, when in fact, that's my opinion, I think they should be ashamed of themselves, really. But that's my personal opinion, obviously. But yeah, definitely LGBT rights across the globe, they're probably at risk. Everything is so fragile for everyone. Rena?
I just wanted really to say and remind us all, I'm sure most of the audience will know this, that a lot of these things are illegal. What they have, the story that we heard from Patricia is illegal. The story that you're saying, Alfonso, is illegal because there are laws from the European Union that provide for the rights of all sorts of minorities, including the gay, LGBTQ plus community. And I think, you know, we need to have some brave people who can take these discriminators and these people who are operating illegally to court and to challenge them. And you know, there are lots of large charitable organizations, community organizations, both, you know, in the UK there are, and I'm sure there are in the Scandinavian countries. Take them, they have the money and they have the resources to actually challenge some of these illegal things that are happening. But I don't see any of I don't hear of any cases that have gone to court. And I think it's about time. That's what I believe. We need some brave people.
Definitely. Anybody else would like to share in their countries what the situation is like? Or any comments, any final comments, because I'm aware of the time as well, in terms of LGBT older people or LGBT in general? If not, I can see there are lots of resources in the chat that people are sharing, which is great. Please do share them. What I'll try to do at the end of this webinar, I'll try to copy them and put them in the Slack group as well, so that we do not lose all of these amazing resources. But maybe the last point I could close on is that I think that when we talk about LGBT and LGBT older people, we need to be very much be mindful that it's not just the business of health and social care professionals or one person over another or the LGBT people themselves. I think it's everyone's business. And you, as I usually say, you don't have to be gay, lesbian, bisexual, transgender to be part of the LGBT plus umbrella. We actually have a letter A within the acronym, which stands for ally. And I know you may think this is not a war. It's not a war, but you can show your support to the LGBT society by being a friend. And by being a friend, we mean that you advocate for LGBT people, you safeguard them as much as you can. You can be more inclusive in your own practice. For example, I hope that over the past few weeks, we have learned how to use our inclusive language. Things like pronouns. I can see that a few people have the pronouns now in their names, which is great to see. And I know we may think not all languages will allow us to use pronouns or to use gender neutral languages, but actually there are ways to get around it. Even I'm aware, for example, in the Italian language, they're trying to use the schwa at the moment, which not everybody agrees, of course, but at least we're talking about it. And by talking about it, we're doing something, we're doing a step closer. As Rena said, we need brave people to take things to court if we have to, but even talking about things and even raising awareness about simple issues. I think we also heard some stories around privilege, and there can be privilege, not just heterosexual privilege, but also privilege within the LGBT society. I, for example, I know I am white, so I have that privilege despite being gay myself. And I may have other privileges which I'm not even aware of, because those are privileges. So it's important for everybody to acknowledge our privileges and where we can help other people as well. And I think we're just going to close on this now. I do want to say a few more final words in terms of the MOOC before we stop everything, stop the webinar. And it's that, as I said, we have come to week 4, and hopefully you are all learning still. It just feels like yesterday when we started building this MOOC and creating all of the material, and finally we're here towards the end now. But obviously this is not the end, and we definitely do not want this to be the end. We hope that we have given you some tools, or that the things that we have given you have complemented your own knowledge that you already had in the past about LGBT issues. And now I'll be a little bit of the strict teacher by saying to everybody, please do catch up on your activities when you can. But also next week, it's your final assessment week. You will have a case study that you can answer some questions and finish it up. But also your final assessment is to produce, to create something innovative, something creative, whatever it is. You don't have to be an artist. You don't have to be or do anything out of the ordinary. Do what you can, but talk about your MOOC journey or my learning journey on this MOOC, and talk about everything that you have learned in terms of LGBT issues. If they changed anything for you, if improved any knowledge, or if it complemented some of your own knowledge, and particularly how you will use this maybe in your practice, in your job, or in your daily life. So we have given you some tools like Powtoon, I believe it's called, which is a tool to create animations. There are some tools as well. You can just do a PowerPoint presentation. You can record a video. You can write a poem if you are a writer, for example. You can write or do anything that you want, or you can simply just do a reflection. Just do whatever you can and share it with us. And if you're very happy for us to use it, we will be very happy to publish this on the IENE website as well, so that we can make it available. Your name will be there, of course, and you will be acknowledged, but at least we can share it with everybody, because what we want by the end of the MOOC is that this work will continue. Even after the MOOC, we are still talking about it, and we're still telling other people about it and making a difference in the lives of LGBT people, especially. Okay, so that's the last thing, I promise. And now I think you all want to go. We are all on different time zones. I'm aware. Here it's very late in London. In most countries, America is quite early, so it's not too bad for you all. But thanks everybody for joining us. Thank you, Anders, again for the amazing presentation, and Richard for your amazing story and for sharing it with us. We really appreciate it. I'm going to stop the recording now.